Well, the doctor is in. Today marks the last day of Black History Month, and while the month is meant to celebrate Black success, it's also meant to spotlight issues that still need change. Here at CBS 8, we want to close out the month by highlighting the importance of health care in the Black community while discussing the impact of racial disparities. Joining us live, Chief Impact Officer at Sharp Steele, Dr. Abby Olulade, to give us more insight on this. Thanks so much for coming in.
It's good to see you.
Let's talk about some of the health issues that are prevalent in the Black community. Touch on that, and then we'll dive into some of the reasons behind it.
So Black people have higher rates of a lot of chronic conditions, including hypertension, heart disease, also diabetes, kidney disease. So this is something that we see, and even with cancer rates, with most of the major cancers, Black people have a higher incidence of this. And this is a huge disparity and something that we really, really need to address.
What are some of the reasons behind that?
So it's complex, but a lot of the things that we call social determinants of health are also disproportionately affecting people in the Black community, and things that are indirect factors that have direct effects on medical outcomes. So things like not having enough access to resources, not having a good education, not having financial stability, not having transportation, safety. All of these things are things that affect the African American community disproportionately. And of course, the effect of racism, discrimination, and bias. So these are not comfortable discussions to have, but very necessary ones.
Absolutely. So someone watching at home, that part of our Black community that wants to really hone in on their health here, what can they be doing? Is there anything that they can be proactively doing to take care of their own health and then their family's health?
Yeah, so it's important to recognize this, right? Which is that all of these things unfortunately lead to what we call excess mortality. So increase the rates of death and decrease life expectancy disproportionately. So we want to make sure that we start to have these conversations with our doctors early on. We want to make sure that we are watching our diet. We want to make sure we're exercising, but it's not, maybe, not it's not the only question that we should be asking. The question we should be asking as well is, how can we as a community improve these conditions? Because if you tell someone to exercise and they don't have a safe place to do it, they go outside and they don't have access to all these resources, then it's a difficult thing to say. They can't take off work because they don't have the time to, they don't have the finances to be able to do that. They don't have adequate transportation. So it's a question that we should ask as a community. It's not an us versus them problem, because when we improve the health of one aspect of our community, it benefits the community as a whole, and that's important.
I think people would be surprised, some of them, to know about all of the health disparities that exist out there.
Yes.
Can you dive into what can be done? It's not just the folks that are impacted by this, but it's government, it's the state, it's the federal government. There's a lot of stakeholders involved when it comes to health disparity. And it's not something that can just change with the flick of a switch, but there's ways that we can be going in a positive direction, right?
Absolutely, because you're exactly right, Eric. The disparities are stark, even with things like maternal mortality, infant mortality. Even when we had the COVID pandemic, disparately affected minorities to such a great extent. So you're exactly right. We want to make sure that we realize the effects of, for example, government in the past. So there's things like the Tuskegee experiment, which was a devastating thing that actually was done by the CDC. And if you don't know about it, definitely read about it because it's important. But that creates mistrust, and that's something we need to work on. We need to improve education, health literacy, access for everyone, because it's the just and moral thing to do to improve this.
I wanted to talk a little bit about the trust in the healthcare system, the lack of trust that may persist in the Black community with the health community. What could be better to foster that tie, that connection?
So it's important to really start to think about it in terms of education of healthcare professionals, to say that, this is something that we want to do to have inclusion and equity, and we want to provide equal amounts of access to healthcare and quality healthcare for everyone, regardless of who they are. And so it starts at the education level. It's also important to train a more diverse group of physicians and medical providers as a whole, and also just inherently make open and safe spaces for everyone to have good access.
You've always told me
is important.
Have that open conversation, dialogue with your healthcare professional. That's always the best way to go. Dr. Abby, where can people learn more about you and Sharp Steele?
So sharp.com. We always want to make sure that we provide good health care to our diverse population, and we want to recognize that at Sharp. And so definitely sharp.com, look up at doctors.
Yeah.
You can find someone that can take care of you. That's
Thanks
important.
for coming in.
Of course.
Stay with us. We're taking a quick break.